Now is not a time to panic. Now is a time to prepare. We have a window of opportunity. Like I said, we probably will sooner or later see at least one case of this novel coronavirus, if not more. But we want to make sure that everyone is ready and prepared as best as possible, so we can actually minimize the disruption and inconvenience that we know it can cause whenever there's an outbreak in a community. And as we're watching things around the world, we're learning more and more about the virus itself, as well as what strategies are working around different communities here in the US, as well as around the world. I would consider this disease as acting very much like the influenza, and some of the same precautions that we teach about influenza are what we're trying to teach the public about this novel coronavirus. So definitely wash your hands, make sure that you don't have germs on your hands when you eat, really throughout the day, so that if you accidentally touch your face or your nose, that you don't introduce germs into your body. Secondly, if you have any coughing or sneezing or even an upper respiratory condition like the sniffles or bronchitis, go ahead and put a mask on. That's really the right thing to do, and that's really the time to put a mask on. You don't need a mask if you don't have any symptoms and you're feeling well, but if you're feeling under the weather and you have all these symptoms, you don't want to spread those germs to the community. So those are the folks that we really want to be using a mask. The third thing is go ahead and get your flu shot, because like I said, the flu is actually a much more prevalent hazard in our community than this novel coronavirus, which has been described in the US. We know that it might make its way into Fresno County sooner or later, but right now the flu is here. And if you haven't had your flu shot, then you're definitely vulnerable to catching influenza. The flu shot is actually a vaccine for just the influenza virus. Unfortunately, it doesn't actually protect you against this COVID-19. People are working on that vaccine, but that vaccine is not ready. It's really being studied in the research trials and things like that. It may be a year before the vaccine is available to the general public. So getting a flu shot means that you'll be protected from the flu, and hopefully you'll be less symptomatic and less vulnerable. But unfortunately, it won't protect you from the novel coronavirus. Really what we're advising people is, to treat this like you have a common cold or flu. You may be out of work for a day or two, but you're going to recover with a little bit of rest, maybe a little bit of chicken soup, maybe some fever medicine. And that's exactly what people that even catch this coronavirus are going to need. Most people are going to need just some rest at home, lots of fluids, fever medicine, and then they'll be back to work in a couple of days. So if you're in that category, which most people will be, then go ahead and you can call your medical provider, or if you have insurance, you can call the medical hotline that a lot of insurances provide for nursing advice. But try to avoid the emergency department because they're very impacted and they're busy enough just taking care of strokes and heart attacks and all the other things that they have to take care of. Community Regional is making preparations for an increased number of visits, but actually those tents were for the spike in flu cases. So they weren't even for the coronavirus, as I understand. It was just because there was an increased number of folks that were just visiting the emergency department. Nonetheless, we're all asking our hospital partners and our clinics to just prepare and plan for seeing these cases. More than the volume of cases, it's really just protecting our patients from transmitting this disease to each other. We want to make sure that patients that have respiratory illness, that all of our medical providers are using masks for them and then asking them those travel questions, and they're getting that message. And so those are the kinds of questions you can expect if you do end up going into the emergency department. And then beyond that, they may be setting up special areas where patients either get triaged or treated. Those are all things that are being planned and prepared for, and we will definitely be working with them on a day-by-day basis to make sure that everyone's on the same page about how to handle any community cases that we all experience. We're educating our medics, and we're also learning from them about what their needs are. And we're talking to school districts, we're talking to community-based organizations, daycares, elder care homes, nursing homes, civic institutions, tribes. So we really want to reach all of the groups that we need to reach so that they can get consistent, safe, reliable messaging and help protect all of the people that they serve.